Healthcare is dynamic. It is evolving in unique and complex ways. One of the primary concerns is keeping up with the demands of an expanding population. This has led to new fields of study and exciting research opportunities. These breakthroughs and ideas are crucial for the future of healthcare, but they are often constricted by the prolonged periods of time it takes to test and implement. However, with the technological innovations currently available, it doesn't have to be that way. What if medical products could be tested the moment they are thought of? Or if new procedures could be examined in real time without risks? The answer to these questions depends on healthcare adapting in ways that embrace the technological resources we have at our disposal.
We do a lot of research in healthcare and trying to improve the delivery and practice of healthcare. Unfortunately, there are a lot of things that are not going right with the healthcare system. Between 45,000 and 98,000 people died because of preventable medical errors.
We need to find a way to understand the process of home care between nurses and patients, or between and among family members, and our virtual reality space is allowing us to do that. We believe we have an opportunity to use a physical environment, to use the visual images projected on the wall to create a space where individuals can think about home care challenges and resolve them in ways that we've never thought before.
One of the big areas in physical therapy that we face now is trying to maintain compliance and understanding in our patients in their home environment. When they leave the clinic, we really don't have a good way of understanding exactly what they're doing. The more we can simulate what their environment in their home is, the better we can tailor their exercise program to them.
You cannot design an interface that everybody can use. There's no such thing as one size fits all. But what we can do with modern technology is we can create a product which has an interface which can change, which can adapt, which can auto-personalize to the individual.
Here at the Wisconsin Institutes for Discovery at the University of Wisconsin-Madison, researchers have innovated an interactive experience to address these questions. It has taken countless home visits, data collection, a simulation lab at UW-Madison's nursing school, and inspired nurses, engineers, and computer scientists to create the cave in the Living Environments Laboratory. The cave, or Computerized Automatic Virtual Environment, allows investigators to replicate any environment on Earth. The user controls the cave in real time with a remote synced to a series of supercomputers. These computers relay a video signal to 12 state-of-the-art projectors to create an interactive, three-dimensional space. There is no limit to what the cave can do.
When we design systems and technologies, we can fit them and test them in the cave more easily, more quickly, and then those systems can be implemented in the real environment, in the real world, in real homes or real operating rooms much more quickly, and therefore we should see the benefit in terms of patient safety.
The same technologies that are presenting problems and are creating a crisis, if we design them properly and we add in this idea of auto-personalization, it gives us the ability to explore how we might design the world, how we might change environments.
To be able to bring the patient in, replicate their home, and allow them to perform their treatment program within the actual context of their environment. It will improve compliance, it should improve exercise technique. That will translate into improved clinical outcomes.
So we have an opportunity in the Wisconsin Institutes for Discovery to rethink the whole design process, the whole home care process, and to create a new generation of tools for technology-enhanced home care. We're trying to move to the day where smart homes and aware houses become tools for health, not just spaces where health occurs.
The University of Wisconsin-Madison continues to pioneer technological innovation and provides fresh perspectives on the challenges of healthcare. To move forward, it will take the combined effort of many disciplines, brilliant minds, and support. The goal is a redefinition of the home, how we interact with our environments, and a reshaping of the healthcare model. The research in the cave is where that begins. Sometimes, to think outside the box, you've got to step inside the cube.